Social justice analysis. It is essential that the nursing profession continues working on issues of social justice. The current healthcare and social environment require coordinated action to reduce health disparities and social determinants of health. Nursing Code of Ethics describes the moral character of nurses, requiring justice, autonomy, altruism, advocacy, courage, and integrity. We are obligated and guided by our moral compasses and empowered by our professionalism to focus on improving social justice. Our healthcare system, our social systems, and economic systems are the mechanisms that promote social injustice and health disparities. Nurses are in the unique position of having intimate relationships with individuals and communities, while also having the ability to influence the systems which have unfairly and adversely affected groups of people. The nursing profession has a moral duty to change these systems, to reduce suffering and the waste of human resources. Capitalist values have shaped our healthcare system. The current healthcare system is driven by market forces. Dr. Paul Farmer discussed how investor-owned health plans and consolidation has led to a major industry which, like most others, is profit-driven. Healthcare now is often a service only available to those able to pay for it. Those who cannot pay, the poor, and often the sick, are not considered cost-effective and experience differences in access to and quality of care. Systems or programs that are designed to help the poor have to be self-sustaining or cost-effective. Systems that ignore or hurt the poor and sick are supported and rewarded by the profit-driven system. As a result, social inequities are embodied as bad health outcomes. For nurses to focus only on the care of individuals is incongruent with our moral code. It is our duty to lead, advocate, and influence health systems, aiming to protect human rights and to reduce health disparities. Failure to act allows and supports profit-based health delivery, grossly underserving many groups of people. Market forces and corporate interests should not dictate health delivery. If nurses fail to act, if we ignore these flaws in healthcare delivery, we ignore the plight of the underserved, and we are perpetuating an unethical system that violates human rights. Health disparities based on race, income, gender, sexuality, and location, among many others, are a reality. Dr. Kamara Jones makes an interesting point about social determinants of health, saying that simply addressing health service disparities does not fix health disparities or outcomes of vulnerable populations. A more powerful prediction of health outcomes relates to social qualities, such as poverty and race, likely because of differences in opportunity, exposures, and stresses. We have social and economic systems in place that value some groups of people more than others, systems that disadvantage or advantage some groups more than others because of socially assigned qualities. The current Code of Ethics for Nurses discusses social justice as a responsibility of all nurses. The health disparities many of us witness and experience in our professional and personal lives are a result of social injustice. We operate within many societal systems of power that establish norms, values, and structures in our communities. It is vital for nurses to participate in these systems of power to influence structure and mechanisms that shape healthcare, health delivery, and reduce the impact of social determinants of health. Our moral code as nurses compels us to think and act expansively. Nurses, as individuals and as an institution, must have an active role in shaping health through leadership in policy, engagement in political processes, and advocating for social justice in these roles.